Hello everyone and welcome to this career conversation about advanced practice. This is a podcast series produced and recorded by the Royal College of Occupational Therapists. We'll open up the conversation about advanced practice and explore what it means to our profession now and into the future. I'm Claire Guyatt, Occupational Therapist and Practice and Workforce Manager at the Royal College of Occupational Therapists. And I have the privilege of meeting some of our occupational therapy workforce through these career conversations. So in this conversation and podcast series, we'll be sharing our conversations with you. We'll be talking about occupational therapy and advanced practice across a variety of sectors and settings. We'll take a deep dive into people's journeys and learn how they are leading the way for our profession. Whether you're an experienced advanced practitioner, just starting your journey, or curious about how advanced practice is transforming care for our people and populations, then this is the place for you. So grab a cuppa, settle in, and let's chat advanced practice. So today we're joined by Thomas Edwards, who is an occupational therapist and works at an advanced level of practice. And he's going to be sharing his journey into advanced practice and occupational therapy with us. So Thomas, can you introduce yourself, your job role, and a brief description of what it entails, please?
Hi there. Hi, Claire. So I'm Thomas Edwards. I'm a clinical lead therapist for the emergency department and acute medicine areas at Chelsea and Westminster Hospital. So I actually oversee the therapy teams that cover both of our EDs and acute medical units on 2 hospital sites. I manage teams of both occupational therapists and physiotherapists. So although I am an occupational therapist, a lot of my skills are enhanced anyway to cover some of the traditional physiotherapy assessments so that we can provide a more transdisciplinary role. As clinical lead, I'm also involved in supporting the multidisciplinary team with more complex cases. So particularly in the emergency department with patients who are presenting with a fall where there's no obvious medical cause, but I might be asked to provide some advanced expertise to both identify the causes and the onward management.
Brilliant. Thank you, Thomas. That sounds really interesting and quite varied, and I'm sure we'll go into that in more depth in a moment. But just so we get to know a little bit more about you behind your job title and your role, can you tell us a bit about yourself, maybe what your favourite occupation is?
Yeah, so I live in Farnborough in Hampshire. I have 2 children. I'm actually visually impaired, and both my children inherited our condition. It's quite a rare condition called aniridia that's about 1 in 200,000 people. So it's very much informed a lot of my life and my passion for occupational therapy. I'm also a railway enthusiast, so I love riding trains, and that's one of the things that really helps me to kind of relax and unwind after work. And I'm also building a model railway.
Brilliant, Thomas. Thank you so much for sharing that with us, and so we can get to know you a little bit more. Now, before we start talking about your journey into advanced practice, I'd love to get to know you sort of more from the beginning of your journey into occupational therapy. Can you tell us a little bit more about what attracted you to become an occupational therapist and how you discovered occupational therapy?
Yeah, so I started my adult working career in the ambulance service in the control room, taking 909 calls and dispatching ambulance resources. And I recognised from very early on that there was this group of patients who were calling 909, coming into hospital, going back home, calling 909 again. And without knowing about occupational therapy, I just recognised that this group of people needed more meaning and purpose in their life. And so a few years later, by accident, really, I got chatting to an OT that worked with visually impaired children. And so that naturally struck a chord with me because of my own visual impairment. And when I looked into occupational therapy, it just included everything I always wanted from a career, that kind of more hands-on, face-to-face, promoting independence, designing and problem-solving things. And so I really was interested in occupational therapy as a career, but I didn't want to leave the emergency setting. a few weeks later, I happened to find out that there was actually an occupational therapist that worked in the local emergency department. And so I arranged to spend a day with them. And the first patient we saw had actually taken the 999 call for the day before. And so straight away, I could see how it all linked together. And that's really what uh, gave me that love for occupational therapy in the emergency care setting.
Wow, Thomas, it sounds like it was all meant to be, really, and lots of things aligned there for you in your journey and your life, really, to make you discover occupational therapy. And it actually, yeah, it gives me goosebumps to hear your story. And I love hearing people's experiences of how they discovered occupational therapy and where that passion comes from. So thank you for sharing. And now, if we delve a little bit deeper into how you became working at a level, or how you become an advanced practitioner, maybe we can talk about what you kind of identify as. Do you identify yourself as an advanced practitioner or as an occupational therapist? In terms of your role, what would you describe it as?
Yeah, it's interesting. I haven't really landed on a clear title. When I first completed my kind of ACP accreditation, I was calling myself an advanced clinical practitioner, occupational therapist. But what became quite apparent was that my role was different to the other ACP roles within the organisation, and so more recently I've adjusted that just to advanced practitioner occupational therapist. It's difficult because in my role, because I work not just as an occupational therapist but across the multidisciplinary team and do sometimes use those medical skill sets, that I think it's really important that we have a title that recognises that the role goes beyond occupational therapy, but I also think it's important to keep that occupational therapy in my job title. So I'm open to any suggestions.
Thank you. That I thought before we went into the actual question we were going to ask, I just thought I'd ask you what you
Yeah.
refer to yourself as, because there's lots of different variations out there. It's a good one to consider. So can you tell us a bit more about how you became an advanced practitioner occupational therapist then?
So from very early on in my career, I had a passion for advanced practice, and was, even as a junior occupational therapist, I was involved in writing guidance for occupational therapists working in the emergency department. I undertook a master's in advanced professional practice in healthcare back in 2010, and that was very, it was less clinical focused, it was a lot more leadership focused, but again it just demonstrated kind of how passionate and forward thinking I was about the need for advanced practice. And more recently, I was then involved in developing competencies for allied health professionals working in acute medicine. And within that process, we identified that there was several levels of competency, and one of which we identified should be advanced practice. And again, I was very strong in advocating for the need to ensure that there was this kind of continuous development opportunity, and that particularly as occupational therapists, we can go above and beyond our own scope of practice in areas where it's needed. So when kind of the formal advanced practice kind of frameworks came along, uh, it naturally appealed to me. But because I had the masters, I didn't really want to go back and do it all over again. And it was actually an RCOT session about advanced practice that I discovered that Health Education England were offering the e-portfolio route. And that made a lot more sense to me. It seemed to make work much better for my needs. And the portfolio route is about providing evidence to demonstrate you're already working at advanced practice level. They do a learning needs analysis and will support you with any areas that you maybe need to still develop in. And they agreed with my assessment that it was still that clinical area that I just needed to advance a bit more in. And Health Education England were able to support me to attend the Master's clinical examination module just to essentially complete my portfolio. And it was a really, on the whole, it's a very good process. I really enjoyed it. But I think the downside to that process was that it wasn't an apprenticeship route, and what I lacked was that opportunity to practice those clinical skills. That said, what I was able to do was to pick the skills that I felt were most relevant to my practice, and I feel more confident in using tools such as tuning forks and the stethoscope as part of my occupational therapy practice because of that course. So overall, it's a really good positive experience.
Brilliant. So you've spoken about that positively. So can you pinpoint any enablers that helped you along your way to being able to become an advanced practitioner?
For me, a lot of it was my kind of passion, ambition, and kind of that drive to achieve it because I wasn't following the apprenticeship route, there wasn't a lot of internal kind of support and recognition for that pathway. And so I really had to kind of find the opportunities and create those opportunities for myself. I think it helped the advanced practice as a whole, and particularly in the kind of acute settings and frailty and those kind of areas, was kind of growing, that it did generate discussion. But a lot of it came from me internally, and one of the resources that I found most helpful was coaching, because coaching empowered me to find my own journey, find my own route, and so that was really helpful in helping me to kind of really achieve what I wanted to achieve.
Mm, that's brilliant. And where did you find your coaching? Who did you get that from, or how did you
It,
identify it?
it was actually my manager that had suggested it, and she kindly then reached out to our HR department, who were willing to support that. And so it's the organisation that's just actually supported. But I think coaching increasingly is becoming quite commonplace. Actually, on the back of my advanced practice training, I'm now also doing an apprenticeship for coaching because I recognise how important, how valuable those coaching skills are, both in terms of developing myself at advanced practice level, but also in supporting others to achieve advanced practice.
Brilliant. Thank you for sharing that. That's really interesting. So we've spoke about some of the positives and some of the enablers. I imagine you possibly came across some barriers along the way. Is that right? And what were those barriers?
Yeah, so I think one of the biggest barriers was being an occupational therapist, because particularly from the medical model focus on advanced practice and the inability to prescribe, but also because often our sort of anatomy and physiology knowledge is less so than other HP professionals, that there just wasn't this recognition that occupational therapists can advance in their career in this way. And so that was meant that I almost felt I had to kind of justify myself all the way through the pathway. Prescribing continues to be a real challenge. I've applied for a number of advanced practice jobs that doesn't necessarily need me to prescribe, but may need me to supervise others who prescribe. And the inability to prescribe myself is very much seen as a problem. And it's frustrating because I think there's so many other opportunities outside of medical prescribing. Um, Other barriers, I think, for me was again the time and the resources. So outside of the apprenticeship route, there was very little support to give me the time that I probably really needed. And so a lot of my portfolio work I was doing at home, um, and a lot of the development work that I needed to do, with the exception of the master's module, I was kind of doing on my own time. So that was a real barrier for me as well.
Thanks for sharing that, Thomas. And out of interest, how long did it take you to do the portfolio route?
So the portfolio route itself is an 18-month program. So as with kind of most sort of portfolio-based apprenticeships, that the idea is that you kind of spend 12 months working on the portfolio and then 6 months of um, independent kind of review and kind of adding anything else. Uh, I was really lucky because a lot of what I was already doing in my day-to-day practice was actually directly fitting into what I needed for the portfolio. But interestingly, my brother, who's a paramedic, was on his was also doing his e-portfolio at the same time as me, and he took a lot longer. So he took, whereas I completed the portfolio within the 12-month window, and I was accredited within 14 months of starting. My brother took about 24 months, I think, in the end, because he wasn't, although clinically he was able to do the clinical things, he didn't have the same opportunities from leadership and kind of management, research, and education perspective that I already had the opportunities for. So he actually found it harder, even though he had less formal education to complete.
Very interesting to hear the comparison with another allied health profession there. Yeah, that is interesting to hear those barriers. It sounds like but through a lot your own tenacity and determination, you've found your way to where you wanted to in your career, from an advanced practice point of view, but not without there being some challenges and barriers along the way. You mentioned working in quite a medicalised environment in the NHS in a busy acute setting. And there's been work that's been done recently in collaboration with the Royal College of Speech and Language Therapists and the Royal College of Occupational Therapists, looking at reimagining what the future of advanced practice can look like. And this articulates advanced practice through more of a social lens and looks at concepts like social justice, and ensuring that our practice and our vision takes on that wider biopsychosocial perspective, so to speak. So we can look at tackling health inequalities and responding to changing societal and population needs. So the vision embraces inclusivity. The aim is to strengthen those such as yourself that are already in advanced practice roles, but also it helps to broaden our profession's position for the future and what advanced practice could look like for the future and in terms of future service delivery. And it recognises advanced practice not just within the NHS, but it has scope across health, social care, across different sectors and settings across all 4 of the UK nations, and in statutory and non-statutory services. So as we've mentioned, it is very inclusive. Based on all of that, and considering you work in quite a medical model environment at the moment, what are your views of this new articulation of advanced practice for occupational therapy?
I think it's a really good opportunity, and I hope that what it will do is really bring occupational therapy to the front line of advanced practice by bringing our own unique skill set. I really like the idea that of particularly the health inequalities. I think this is where occupational therapy really can kind of justify itself a bit more advanced practice, because it doesn't need medical prescribing. It simply needs the skills and the expertise to understand the person, their environment, and the occupations that they engage in, and how health and well-being contributes to that. And often occupational therapists, with their problem solving expertise, can access the communities that are otherwise disadvantaged by that health inequality. Within my own setting, I can still see it as a real value in terms of, I think it will help to demedicalize a lot of processes. There's still too many patients that come into the hospital, and our primary response is to give them medications when that may not be beneficial to them, or they may not want it. And so being able to offer a range of services, including occupational therapists, therefore, as part of that response, to meet the needs of the patient, I think is really, really vital. And it really excites me that we're kind of opening up that vision of what advanced practice is, not just for OTs, but I think for all HPs.
Brilliant, thanks, Thomas. And you mentioned health inequalities there, and also the setting and the acute medical setting you work in. Are there any examples where you think taking this more social model of what advanced practice could be, how that could translate to really benefit perhaps from a preventative perspective in the work you do and the people you work with?
Yeah, so there's a lot of even within emergency care, there's kind of a lot of focus on trying to prevent people from needing to come to the emergency department in the first instance. And the reality is people are going to always present to the emergency department for various reasons, often because they don't have the skills or the knowledge or the ability to access those other services. And so for me, I think there is a huge opportunity to still offer prevention whilst in that period of crisis. And arguably that's the best opportunity because we can address everything there and then rather than referring on and potentially losing patients through that kind of follow-up process. And like I said earlier, for me, it's about then providing the patient with a range of options to manage that illness or crisis rather than medicalising it in the first instance. So I can see a lot of opportunities with it in urgent and emergency care where occupational therapists can offer that different choice of interventions and that can help to provide support and signposting to patients that may otherwise not be receiving those services.
Thank you, Thomas. And when we think of this as a change movement and needing to all join together for the future of what advanced practice can look like, what do you think as occupational therapists we can do? What would you say to the community and workforce of occupational therapists out there? How can they help with this change?
I think we still need the evidence base, and we need to know where we can offer most value. The reality is that I think everyone would benefit from occupational therapists, but where in the system is our need the greatest? And that may be economically in terms of the cost of health services otherwise, or it may be in terms of health inequalities, which group of patients may be traditional services are least able to access. And just thinking about my role in the emergency department, often the patients where I find I can offer most value is the patients who wouldn't normally engage with any kind of health professional at all, and they've only been brought to A&E because of a need for either an injury or because they sort of been insisted that they should go, and often they don't want that medical approach. But whether that is kind of economically or whether that's beneficial to the patient is probably what we need to really truly understand. I think the other thing is, as occupational therapists, what we're good at is creating those networks, and I think and particularly with the RCOT communities, I think there's a really good opportunity to strengthen that network creation by almost informing the pathways. So, if there's a particular population who maybe are underrepresented in an urgent and emergency care system within their local system, are there occupational therapists who maybe speak their language or, just have a better understanding of their needs that can support occupational therapists in that system to access that community more? And I think that's what we do best, is that kind of problem solving and creating solutions. So I think there's a huge opportunity, but realistically we can't do everything, so we have to look at where we are most needed. I was reading an article just the other day from the NHS Confederations, and it was talking about not trying to change things every year, but doing what we already know works. And I think that's the challenge, because I think where occupational therapy can really work is where we don't know if it already works, and it perhaps is that we need to focus on those areas first where we don't know what works, because everyone else is focusing on what does work.
Really interesting points you've made there, Thomas. So the way I was hearing that was the catalyst is understanding the populations that we're serving, and understanding our communities, and then also thinking innovatively about how we can strategically use occupational therapists to the benefit of those people and communities. So having that real forward thinking view of health and care. Thank you so much for sharing that insight. So thinking about this reimagination and the future of advanced practice, what do you think the next steps should be for the future of advanced practice occupational therapy?
I think we need to create the opportunities, and again, that may require systems to be brave and invest, like I say, in areas where they know there's a problem and there's not a clear solution, and be brave and just hold that imagination that occupational therapists may be able to actually address that problem. And the key for advanced practice is it's not just bringing that clinical experience, but bringing the research, the education, and the leadership as well. And so we need to make sure that there are occupational therapists coming up through advanced practice, through the frameworks to be able to take up those opportunities. And then we really need to ensure that systems are identifying those opportunities. I think the advanced practice area is interesting because many roles are open to all HPs in theory. And so at what point do we draw the line and say this is for occupational therapists and this is for anybody? I think where there is that social need for social justice and the health inequalities, I think occupational therapists will hold their own anyway. So I don't think we necessarily need the post to be specific to occupational therapists. I think we just need occupational therapists who are passionate about those areas, who are exploring advanced practice and are able to bring their own unique skill set into those settings.
Great. And Thomas, if you think back to when you first decided you wanted to take your journey into advanced practice, what would you tell yourself back then? And what would you tell other occupational therapists or aspiring occupational therapists or our brilliant support workers for occupational therapy? What would you say to them if they're thinking about starting a journey into occupational therapy and onto advanced practice?
I'd actually say don't rush. I think one of the biggest kind of challenges in terms of my whole career path is that I've spent most of my time in a hospital setting and in an emergency setting, and I was so kind of focused on advanced practice in this clinical area. But actually, what I've then missed out on is maybe clinical and leadership opportunities in other settings that would give me that breadth of experience to truly function at an advanced practice level beyond kind of my immediate kind of portfolio of skills and knowledge. So I would certainly encourage, don't rush, take the opportunities that come up and just keep working, and you will get there in the end. But sometimes those longer journeys are the more kind of fruitful journeys, they're more beneficial.
Really insightful. Thank you, Thomas. And finally, as we're drawing to a close on this conversation, is there anything that I haven't asked that you wish I had asked you? And I will take that into the next conversation I have.
I think you did ask it in a roundabout kind of way, but I'd certainly kind of encourage to ask about what support you used to get to advanced practice, because there's lots of different options. So I mentioned coaching, but everyone will have their own kind of support and resources. There's a lot of different groups out there. So again, the RCOT communities offers a great opportunity. There is Facebook's, there's mentoring, and there's also different education forums. But it's also worth looking outside the profession and looking at other organisations that are supporting HPs towards advanced practice. So I think everyone will have their own list of opportunities and organisations to go and people to go to. So I think it's worth definitely asking that. Yeah.
Thanks, Thomas. There's something in there. The occupational therapist in me wants to say that's about creating an environment, isn't it, that enables us? So creating an enabling environment. And it sounds from speaking to you, Thomas, if you haven't got that environment there in the first place, you went out to seek different approaches that could really help you to be the best occupational therapist you can be and fulfill your ambitions as becoming an advanced practitioner. So thank you so much for sharing your insights and your wisdom and your journey with us today, Thomas. I've really enjoyed the conversation, and I'm sure other people will enjoy it as well. And I will take that question about key areas of support and how to get support into the next career conversation podcast I do around advanced practice. And yeah, I just want to say a huge thank you for leading in this space, and really exciting to see what happens for the future of advanced practice.
Thank you, Claire.